All right, welcome back to Morning Live. You're on SABC 2. Now, a physician, Dr. Nandi, has seen his internationally syndicated health show, Real Health, grow and steadily make him a global doctor. Dr. Nandi is in South Africa this week, and he will be joining South Africa's holistic health champion and campaigner, Stacey Holland, in an open discussion about the impact of living a holistic lifestyle as a preventative measure against any disease. He joins us now in our studio this morning. Dr. Nandi, a very good morning to you. Welcome to Morning Live, but most importantly, welcome to South Africa.
Yeah, good morning. Thank you for having me. Yes, South Africa has been wonderful so far, and so have you. Thank you.
And you've been to Durban.
I've been to Durban. I was there in, today's Wednesday, so 2 days ago. And it's been beautiful as well. The people are very friendly and warm and inviting, so I've had a great time.
Is that a great experience you've had?
So far, yeah.
Is it what you know, a certain picture is always painted about South Africa. Your experiences here at home?
I think it's exceeded my expectations. So South Africa, you know, I went to Durban and I went to the ICC and I stayed at the hotels, and the idea is that people are just warm and welcoming, and you know, understanding that I was from the U.S., so they taught me a lot of different things, and here in Joburg too. You know, it's really a city. It's a city and has a lot of cultural diversity, and so I've loved it so far. And I came, as I was speaking to you before, for the AIDS meeting, and it was a historic AIDS meeting in 2016. I've been involved in HIV prevention and treatment as a medical student. I came to one of the very early AIDS meetings to present. So it was very nice to see it come full circle, where we're talking about getting rid of this disease, eradicating it. And that warms my heart because millions have died because of it. So we were filming some of the international leaders for AIDS at the conference, activists, and we also joined an organization called the Key of Hope, went to the townships. They visit 2,000 families, children every week that are disenfranchised because of HIV and other diseases. Went to the township, and really it was a wonderful experience. I loved seeing the beaches of the Indian Ocean, but my heart was warmed by going to the townships and seeing what real South Africans do for their community. Getting
to interact with the orphans I take. But just a quick one on the conference. Your take on the discussions that came out of the conference.
Very optimistic. People are, you know, I talk to people all around the world, including South Africa. The incoming president of the International AIDS Society is from South Africa, Dr. Becker, and she was very optimistic that we're going to turn things around here. One of the reasons why I wanted to come is because South Africa has so many patients with HIV/AIDS, and I wanted to know, what is it about South Africa that makes that happen? So I was part of what I was here for was that. But you know, the health department here has done an amazing job that a lot of us can learn in North America and Europe about how to fight diseases. I mean, you get texts when to take medicine. It's unbelievable. You know, we have problems with TB and other diseases globally, and we can learn from South Africa. So the take was positive, and I really think there's a chance that we could get rid of this disease by 2030. We've come a long way.
All right. Now, back to why you're here this morning. Holistic living. For someone who has never watched your show, what is holistic living and how important is it for everyone?
So our show, Ask Dr. Nandi, is a medical lifestyle show. And what we talk about, holistic living to me, is how to make yourself whole. So you cannot talk about, you know, living a life that's fulfilling without talking about, listen, you know, what else besides medicine and treatments? I'm a physician. I believe in Western medicine, and I prescribe medications and treatments. But there's more. There's how can you bring the best out of your body, out of what you already have. So that's the whole idea behind the show, and it's being globally accepted. We're in over 85 countries now, and besides the United States. It's the reason why is because everywhere, including South Africa, people are saying, listen, you know, I want to do more than just take medicines. Medicines have side effects. Treatments have side effects. What can I do to make things better? So in a nutshell, what we talk about is, first of all, we try to get the why. So how do you get the goals to say, I want to have a purpose-driven life? So instead of saying, I want to be just like the soccer star or the film star or the person who sings these great songs, how do I make my health the most important thing? That's the first step, the why. Then, when you know that you have a purpose-driven life, then how do you fuel that body in the right way? What nutritional techniques can you have? And I believe in keeping it very simple. So don't have little potions or measure this or measure that. Make it very simple. So be able to eat what you like and still be able to do that.
So basically, it's not just something to do with your body. It's got to do with your mind as well. It's psychological as well.
Well, the last thing is absolutely spiritual and family. I think one of the biggest problems we have all over the world is that we're losing the family unit and we're losing spirituality. So the mind-body connection is real. We used to think it's just something that's conjectured, but now we know that basically there are nerves that connect the mind and the body. So when your mind is not appropriately in the right place, then your body doesn't function efficiently.
All right. But how have you used this holistic message to make your advice globally appealing? I
think that people everywhere are more interested in their health. Listen, when you get sick, and I'm sure you've been sick and I've been sick, it doesn't matter what kind of car you drive, what your job is, what kind of house you have, everything stops. So people are interested in saying, what more can I do? Especially the newer generations. They say, you know what, we need to do more. So I love to use all the techniques that have been there in Eastern medicine, African medicine, that then you can incorporate into Western medicine and bring the best of those two worlds. And that's how I've used holistic medicine. And I think that's appealing. It used to be like you either do Western medicine or you do the alternative holistic. But now you can put them together and get great results. I treat hepatitis C, for example. We used to have drugs that ravaged the body. People hated it, and they used to say, I don't want to take the medicine. But I would say, listen, why don't you talk to your herbalist doctor or talk to your acupuncturist? Get rid of the side effects so then you can have a great concert of ideas that work together.
Sure. Okay, but for you, what are the biggest health challenges in the world right now and the solutions thereof?
That's a great question. So throughout the world, I think one of the main problems is obesity. People are just not moving anymore. They love that thing in their hand called the phone, the mobile creature that they love, right? Everything, they're sitting on the couch. You were just talking about Pokemon Go. Mm-hmm. Now, they can't even move without the phone in their hand, right? They're walking around looking for artificial creatures. So one of the biggest problems is that obesity and all that follows from it. I was in Dubai, a few months ago. Same problem. People are just not moving, and obesity is ravaging us. So then what results? Cardiovascular disease, heart disease, strokes, hypertension. If we simply get up and move, what I say is, move with purpose. Don't just go to the gym or say, this is my time for exercise. Make it a part of the day. Take the stairs instead of the escalator. Walk to work if you can. Do gardening. So I think number one is obesity. Number two is people don't have purposeful lives. So they're just kind of aimlessly walking around and saying, you know what, I'm going from one task to the next, one promotion to the next, one car to the next, having a purposeful life. So we coined the phrase, be your own health hero. If you can be your own health hero, be an advocate for your health, then you can do more. And that's the message I think is resonating. I'm writing a book about it. It'll come out in January with that title, Be Your Own Health Hero, and kind of delineates and defines that.
But someone listening to our interview this morning would be saying that it's easier said than done, especially having to not use the escalators, taking the stairs. But I believe that, like you're saying, that it's got to start where you have a purpose in life.
Exactly. You have to have a purpose. And that's not easy to do. I mean, we're talking about it because we don't have a lot of time, but the thing is developing a purpose may take weeks or months. Finding out what it is that you want. You don't have to have a television show or be an Olympic athlete. You can just be a great parent. Whatever your purpose is, and then once you have the why, then you can do the how. And it really is not hard once you commit to it. Even if you walk 15 minutes a day, that will change your numbers. What I mean is that it will change your blood pressure. It will change your heart risk. In fact, if you walk 15, 20 minutes a day, your risk of diabetes will decrease significantly. Just a simple thing like that. Imagine then you use with that an adequate diet. Imagine you use with that spirituality and a family unit that has been shown to reduce stress, reduce some of the problems that you're having. So a concert of ideas that can really make a difference in your life. It sounds simple, but people are not doing it. I mean, people don't even want to prepare their meals. They'd rather go take a takeout, right?
Yeah.
So it's just simple things that you can do, but small changes that lead to big results.
All right. So are you going back home, or will you be giving some talk here in South Africa?
Yes, so we're as soon as I leave here, we're going to the Joburg Stock Exchange, and I'm being joined by Stacey Holland, and we're going to answer questions from South Africans. I love the fact that the same ideas that we had in Detroit, Michigan, you fly across the globe and people have similar concerns. And to be able to interact with our fans, it'll be an amazing event. So I encourage anybody who can to join us.
All right. Now, Dr. Nandi, thank you so much.
Well, it's my pleasure. Thank you for having me.
Thank you very much indeed. There you have it. Dr. Partha Nandi, I beg your pardon, talking to us. You just want to listen to him, talk about being your own hero. Well, we're taking a break, and Morning Live continues after this.